close the bars and keep the schools open is what we really say. Obviously, you don't have one size fits all. If you look at the data, the spread among children and from children is not really very big at all, not like one would have suspected.
Okay, so it's been a bit of a yo-yo for the families as authorities shut down the schools in New York before Thanksgiving. Based on the increased number of cases, they went up to 3%, but they disregarded that data and on in-school transmission, which is very low. So my next guest has repeatedly pressed the doctor on the science of this shutdown for months.
Dr. Fauci, every day, virtually every day, we seem to hear from you things we can't do. But when you're asked, can we go back to school? I don't hear much certitude at all. I hear, well, maybe it depends. All of this body of evidence about schools around the world shows there's no surge.
I feel very strongly we need to do whatever we can to get the children back to school.
Okay, so joining me now, Senator Rand Paul of Kentucky. Senator, good to have you back tonight. So now it's close the bars, open the schools. I don't know how parents and families across the country are supposed to navigate all of this. It's like, okay, now you got to find someone to help you at home, or you have to stay home and leave your job. And then the next week, oh, we're going to reopen them, even though the infection rate has actually gone up during that time period in New York. Can you explain what's going on here?
Well, here's the interesting thing. You know, when I tried to get Dr. Fauci to look at the data 6 months ago on children, the data from Europe where they were keeping schools open and they did not have surges, he was unwilling to look at it. And he was so overly cautious that he wanted to keep schools closed. Now he says, oh, well, we can open some schools, but not other schools. But really what we have to do is close bars. Well, really what we should do with Dr. Fauci is sit him down and show him the evidence on lockdowns. When you look at lockdowns and you look at the mandates, whether they're masks or whether they're how many people go to a restaurant or how many people can gather, and you look at when the mandates were instituted around the world, country after country, guess what? The virus rises exponentially after the mandates. Right now, we have more mandates in place than we've ever had. We have more mask wearing than we've ever had. Yeah. And yet the incidence of the disease is exploding, really maybe showing us that what we're doing is not working. We ought to be open-minded.
You know, and that brings me to this. This is a flashback soundbite on the issue of masks from Dr. Fauci, and this is March 8th. Watch this.
Right now, people should not be walking. There's no reason to be walking around with a mask. When you're in the middle of an outbreak, wearing a mask might make people feel a little bit better, and it might even block a droplet, but it's not providing the perfect protection that people think that it is. And often there are unintended consequences. People keep fiddling with the mask and they keep touching their face.
That totally changed.
Well,
that completely changed.
You know, the New England Journal of Medicine in the summer said that masks were a talisman and they could help with generalized anxiety, but didn't work outside the hospital setting. What I would say to people, because I don't want people to think that they don't work at all, what I would say to high-risk people, yes, they work. The N95 masks work. The surgical masks are about 50% effective in blocking virus-sized particles, and the cloth masks block about 3% of virus particles. So we ought to let this be out there. But if you say things like this, immediately big tech censors you and says, oh, you can't say that. And I say, shouldn't we have a debate and a discussion? Shouldn't we look at the evidence? The evidence is in now on lockdowns. It's been in for schools for 6 months. We finally have Dr. Fauci looking at the evidence. Closing schools is not necessary. Now we need to look at the lockdown evidence, and we need to target our approach to those who are vulnerable and try extra hard for those who are vulnerable. But we shouldn't punish all the people across the country, particularly those who are not vulnerable to this virus.
And these businesses, you know, open, closed. I mean, you've got like a third of the businesses across the country that are probably never going to get those stores and shops and bars and restaurants reopened. And this is the guidance. And now the Supreme Court decision on religious gatherings has thrown a wrench into what the guidance is from these state leaders. The governor in New Jersey today said that new rules, so for outdoor gatherings, you've got to go to a maximum of 25 people. And they're canceling all the winter indoor sports, basketball and that kind of thing. Maybe that makes sense. But then he says that there's the exception to the 25 people rule with religious, political activities. Both of those are included. Funerals, memorial services, and wedding ceremonies. There's no 25-person limit on those.
I wonder if there'll be an exception. You think there'll be an exception for the inauguration? So the thing is we need to look at the evidence. Dr. Fauci, it took him 6 months to agree with us that schools should open. My governor just this week is closing down the schools. So we took it to the Sixth Circuit and we won at the district level, lost at the Sixth Circuit. Now we're going to the Supreme Court with it. But he's mandating that private religious schools can't open, even though Dr. Fauci and the so-called experts have finally come to agree that the schools should open. Our governor, Democrat governor in Kentucky, is closing them all down by fiat with no consultation of the legislature or anyone else. So really, we should look at the evidence. But the most important thing about this is science is about disputation, the same way politics is. You present your evidence on both sides, and we should hear out both sides.
Yes.
What we're living in is a world where we censor people like myself who have contrary ideas, but who look at the evidence every day. Right now, New York is having virtually 0 deaths. And you have to say, is that because they're washing their hands better? Or might it have something to do with the degree of immunity that their vulnerable population got? A lot of them died, but those who didn't die in the nursing homes, a lot of them have antibodies now. Could it be that the immunity among the vulnerable in New York is at such a state that their deaths have gone way down because their vulnerable people actually have a degree of immunity? But nobody wants to talk about that. You put that on Twitter and they flag you like you're somehow denying science, and all we want to do is debate the science.
Yeah, I know Dr. Fauci has debated you on that issue of immunity as well, and it's probably something that we're not going to get a good handle on, I don't think, for some time when we get a real grasp of how many people actually have the antibodies and how long they work for.
But intriguingly, one of the things I told Dr. Fauci the last time he came to our committee was one of the reasons children are asymptomatic is that I think they've been infected with coronavirus colds, and he disputed that. He went out of his way to say it wasn't true, but now the NIH does say it's true. 43% of kids have antibodies and T cells to coronavirus that are effective against COVID because they've had previous infection with colds. It also may explain why adults like myself didn't get many symptoms, then maybe I'd had previous coronavirus colds that allowed me to have some level of immunity.
Senator, thank you. And Dr. Rand Paul, good to have you here tonight. Thank you.